George Kilpatrick, inspiration for the nation, celebrating people we feel good about. Well, if smiles are your thing, we got two people who are all about that life. Dr. Zina Berry of the Berry Good Dental Services. She's a CEO, president, chief dental person. Some exciting breaking news to share with you, the community. Dr. Jason Harris joins the practice. By the way, Berry Good, a brand new partner with Inspiration for the Nation. And Dr. Harris happens to be my dentist. So that's how that all works out. So I guess I'm moving. But
yeah, it smells that way.
It looks like I'm moving. So Dr. Berry, so good to have you on. Talk to me about what is happening here.
Oh, and you know what is so exciting to have Dr. Harris join the practice. You know, he's a veteran dentist that's been doing great services for the Syracuse area for more than 5-6 years now. And I'm so happy to have him join the practice because we need the help, we need the energy, and we need the expertise that he brings to the table. Customer service, his bedside manners, everything that he is about, it all comes out through his dentistry. And I'm so proud that he's a part of the practice.
I mean, this is like a reunion of some sorts, isn't it?
Yes. Right? Yes, it definitely is.
Talk to me about that, Dr. Harris.
Yeah, it is. So I met Dr. Berry several years ago. I remember I was practicing in the Oneida area and I had a broken tooth. This was back in 2014. And one of the ladies mentioned, oh, this wonderful doctor is in Syracuse, Dr. Berry. I said, oh, who is Dr. Berry? I never heard of her. So I was introduced to her and she fixed my tooth, got me back in order so I can see patients. And she mentioned that she had another office in the New Hartford area and she was interested in looking for another dentist. So I said, oh, okay. She said, well, you need to come out of that clinic setting, come back to private practice. Let's do this. You know how she speaks. And she said, you know, you're tired of that. Let's get back over. Let's do what we need to do. So I met her and I joined the practice in New Hartford in 2016. And then we took a little, decided to go a different professional path for a couple of years. And then this year I was looking to branch out, really join another practice where I can really hone in more skills, offer more services to patients. And there was a couple of complications with my current location where patients weren't too happy. So Dr. Berry was actually looking for another dentist to join the practice. So it was a win-win. We worked well together before. And I was like, hey, it's a no-brainer. Let's do this.
And it's done.
And it's done.
So this is great. Two, known dentists practicing and coming together. I mean, it's happened before, right? This is not new, or what's different about this?
Well, I think what's different about this situation is that usually when you start out in dentistry and you have partners, you grow together. Mm-hmm. In this unique situation, he and I came together. We had already been dentists before, but as we went our separate ways and now we've come back, we're actually bringing together more expertise. So it's almost like having two veterans going at it so that we can give more services to the patients. We can offer other options that generally we wouldn't have if I didn't have a partner dentist. So having all that under one roof is just phenomenal, not only for the staff, but for the Syracuse proper at large, because now we can also make sure the community is getting the dental services. We're setting them up for the Invisalign or any orthodontic care that they want. They have oral surgery needs or whatever needs that they have, we have it under one roof. So having a partner and having a veteran dentist being able to bring that kind of skill set to the table is something that is unspeakably the best thing that ever could happen at Berry Good Dental Care.
Oh, it's so funny.
She's so kind.
Yeah. Do you want to add anything? She was talking about you, so let's talk about it. So I know she's a Meharry grad. Are you a Howard grad?
Yes.
Okay. So we bring in two HBCUs together. We know that many of the nation's, particularly, I mean, a lot of dentists, particularly Black dentists, are trained at one of those two schools pretty much.
Correct.
I mean, many others as well, but a large majority of the
90% of the dentists, the African-American dentists that's practiced in the United States,
those two
have graduated either from Howard or Meharry. And the reason why I say Howard first, because Howard actually was the first HSBC school in the nation, and then Fisk came along later. Meharry came along later. So the two professional schools that actually train dentists supplies 90% of the United States with African-American dental.
And that's something, that's why I said, did you go to Meharry or did you go to Howard, right?
Yes. Yes.
Tell me a little bit about your educational background. We heard that the only reason why Dr. Berry said Fisk is she went to school across the street from Meharry at Fisk. I know I learned that last time.
Yeah.
And she actually could have gone to Meharry early, but she waited a minute. CEO. So see, that's I remember. So what's your background?
Dr. Harris.
So I completed my bachelor's from Albany State University in Albany, Georgia. And then 3 months later, I went off to dental school at Howard University. So once I finished my 4-year degree at Howard University, I did my residency at St. Joseph Medical Center, which is about an hour outside of Philadelphia. And once I finished that, and then my first job was in Syracuse, New York, back in 2010. I was working for Small Smiles. And, I wanted something different. So I joined a group practice in Latham, New York, the following year, 2011. And I worked there for 3 years. At that particular practice, it was 5 GPs and 5 hygienists, and there were a specialist for each discipline. So after I did that, of course, got engaged, and I was summoned back to Syracuse, New York back in 2014. And then I ran a dental program for Oneida Indian Nation for a couple years. And then, of course, Dr. Berry told me it's time to come back to private practice. In 2016, I joined her practice in New Hartford for a couple years. And then I eventually want to get more, I guess, hands-on experience with ownership. So I bought a practice in Syracuse for 3 years. And then during the COVID, it taught me a lot of things about communication and about networking. So Dr. Berry has taught me a lot over the years. When I joined her practice in 2016, I remember those days when she told me that, you got to do molar root canal therapy. You got to do this. And I fought hard, but then eventually I did. So she trained me on a lot of different things early on. And so I took a lot of those trainings she taught me and then implemented that over the years. And then now it's like a perfect marriage. So we have grown leaps and bounds just in the past couple of months.
It's pretty significant. I know a lot of people are afraid of the dentist, and should they be?
No, of course not.
Why
not? You know that, right?
Sorry, absolutely. I said absolutely not. They should not be afraid of the dentist, because technology has really paved the way for dental services to be uniformly delivered with a consistent level of quality without the pain. I mean, literally, that's what you say. I know that, and that's what I believe, and that's what my reviews say. And I work very hard at it.
That's studies and stuff. But when you're sitting in that chair and here comes that needle, the gum and the numbing and I've been fortunate because I haven't had any difficult procedures or anything. I haven't had root canal, whatever. I don't even know what that is, but
that's a good thing.
Yes, okay, but I haven't had that, right? I have had a tooth extracted when I was a youngin', so I have a gap there, and every now and then, I get asked about, do you want to do whatever that is? Is it a bridge that you put there? Is that what it is, or something?
Implant.
Okay. That's what they do now, right? Yeah. See, back in the day, it was a bridge. Okay.
Yes. So you see, and with that whole process right there is where technology has changed in dentistry. Because you're right, when you were a kid, that wasn't a service that was offered. And it is now offered now, not only by myself, but Dr. Harris as well.
So let's talk about teeth, dental care, right? Because I think that's, how do we keep these teeth, from, how do we prevent gum disease? How do we prevent, cavities and things of that nature? what are things that we can do right now if we haven't done any of those things, right? And how do we remember to floss every day and all that stuff, right? All the stuff that when I go, they say, "Oh, you haven't really been flossing as much as you should, bro."
I think that
look at Dr. Harris. He's like, Listen,
HIPAA.
I was going to say HIPAA.
I don't know what you're talking about. I don't know what you're talking about.
You just
well,
yeah.
I think that the number one concern that anyone should have as an adult is getting to the dentist twice a year is a must. And the best way that I think that can help you in regards to preventive dentistry is to start early. So when you have your children and you start taking them to the dentist at 2 years old, right, and they do that every 6 months until they're adults, more than likely will continue the process of having that routine process completed. So as far as flossing goes along with some of your nighttime regime and your daytime get up. So I think the best thing to do is almost you have to match your process of what you're doing at night to include the flossing, because it's something that you shouldn't be doing in the morning because it takes a little bit of time. So I have a little, with all these apps, the apps can tell you how long you're brushing and did you get the right spot? Toothbrushes now are Bluetooth operated. And the flosser, yes. So there's lots of technology out there to assist you with having all the preventive maintenances that you need in order to help you when you come to see the dentist, you don't have any problems. Yeah.
I mean, don't y'all problems is that's your business, right? But like toothaches, and then what are some of the things that happen? Toothaches, and then you have infections, and then you have people who actually lose their teeth, and so then there's, like you said, implants. Are they dentures? Are there still dentures and things of that nature, right?
Yes. One of the most important things we have to keep in mind about gum disease, a lot of people think about gum disease like, oh, it's just my gum tissue. But you fail to realize that the same bacterium that's found in the mouth is also a major component of heart disease. For those who have plaques that are found in the arteries, a lot of people have massive heart attacks. They did inoculation of those arteries and found that the same bacteria that's found in the mouth is also the major component for the occlusions in the heart. So it's very imperative that, you go, like Dr. Berry said, your practice good oral hygiene at night and daytime, and also go for your 2 months checkups just to check for any signs of gum disease, where it's like bleeding when you're brushing your teeth, when you're flossing, you're bleeding, you start to know a little more of your tooth structure than usual, those things. And of course, the typical sign build up on the teeth, those are signs where, you have to do something.
I'm thinking plaque buildup, when you have buildup right underneath your gums for some people. And sometimes it's a lost cause. I know the biggest thing right now that people are doing, there's veneers. That's what they're called, right? How does that, and I tell you, I would be so afraid of that, because here's why. Not because of fear of doing it, because you have to grind your own teeth down to put those things over them. So tell me about that process.
Well, I think that one of the things we have to think about is the damage that's already been sustained to the tooth is something that we're trying to recreate. So let's just talk about two processes that happen. One, when you come to us and you have a front tooth problem, you want to immediately get it fixed, because we want to make sure that we have the smile that we've been always looking for.
Right.
So in that point in time, it doesn't matter if I put a veneer or crown or whatever, you just want something back so you can smile. So the veneers is a conservative way to restore a tooth back to its natural image, if you will, and the aesthetics of it, so that you can keep your tooth for the rest of your life. It's almost like a fingernail covering over your finger, right? So it's very conservative, as opposed to a crown where we have to reduce more tooth structure in order to cover the complete tooth. A veneer only has to have the front part of the tooth covered in order to enhance the aesthetics and to save your tooth.
Oh, so it's not like in the past where you had to,
No.
I don't know, where am I thinking about, like where they had to shave the tooth down to, am I getting that wrong? Where did I get that?
That normally comes from damaged teeth and
okay.
Yeah.
Yeah.
And it all depends on how much damage you have is how much we have to reconstruct. So sometimes we have to put back 50% of the tooth or 25% of the tooth. So it all depends on how much damage has been sustained. But we don't normally cut more than a fingernail's worth of tooth structure in order to restore your tooth.
I think, Dr. Harris, I was thinking about somebody who maybe had really damaged teeth, and so there was a lot of work that had to be done.
Yeah.
The biggest thing, though, every commercial you watch talks about smiles. You know, this whitener, that whitener, put the tray on, and look, if I'm doing that, I want it done overnight. Does that exist?
Dr. Harris?
Overnight whitening?
Yeah, where you go in today, it's white tomorrow.
Oh.
Everything says 2 weeks.
So we do offer in-house whitening services as well. The major difference between in-house whitening and your take-home system is the percentage of hydrogen peroxide or carbamide. So if you're doing something where you want that immediate whitening or immediate gratification, you would do more of a in-house whitening where you have a higher percentage of peroxide. What it does is open the pores of the tooth and pull out the stains that are found within the tooth structure. So for those who are looking for that instant white smile, you want to do more of the in-house whitening. Now, that is dependent upon the level of sensitivity. If you're very prone to a lot of sensitivity, then doing in-house whitening may cause more sensitivity, but there are different agents we can put on after the whitening to kind of combat some of the sensitivity. But if you're looking for a whitening system that kind of whiten over time, then you can do a take-home system where it's a lower dose of peroxide, maybe 15% peroxide, and you're slowly getting to that particular whiteness you're looking for. But normally in-house whitening is that give you that zing, that bright smile you're looking for in a matter of minutes.
Yeah, it seems to be the thing now, right? But I mean, do people, you know, when you see these actors, right? 1 minute, you know, they've got this kind of smile. The next thing you know, it's like, but So tell me what they're doing, Dr. Berry. What are they doing?
Veneers.
Oh, veneers? Is that what they're doing?
It's called a smile makeover. And what they're doing is having their teeth reconstructed, and they have a perfect smile, and that's why you notice it. So let's just take an example, Morgan Freeman as a actor, and for many years, I think most of his career, he's had a certain smile that was natural to him. However, so he had front teeth that were set back, a couple teeth set forward, but for him, that was his smile. But now that he has his dental work and reconstructed that smile, it looks perfect. So it's an enhancement and it looks great, but it all depends on what you want to look like in the end. So if you want the perfect smile, you can have it.
So for what Morgan Freeman did, what is that? 15, 20,000? What are we talking about? Give me a ballpark, bro. Talk to me, Dr. Berry. I want to know. If you want the Morgan Freeman, what does it cost you to get it?
Well, it all depends on what.
No, I'm asking for real though. I'm asking for real because what is if you want that, I just threw out wild numbers. I don't know what the numbers are, but if you want what he got, what does that look like for you?
Well, that normally runs between 25 and about 50,000 per arch. 20 to 50,000. Okay. Per what did you say? Per arch.
What does that mean?
So you got lower jaw, top jaw.
Okay.
So per arch, so the upper arch, and then there's the lower arch.
Oh, so that's just one. So if you really want to, okay. Okay.
Yes, it is, because to reconstruct all of your teeth and to give you back a perfect smile is a lot of work. It's a lot of work that you never see. So each tooth has to be not only reconstructed in a certain way, but it needs to be in sync and harmony with the other teeth so that you can bite properly. So reconstructing what has already been there in human beings in a natural process, for us to duplicate it, to even come close, it has to be precision and accuracy.
So what other options? So that's great. And now if you don't have Morgan Freeman money, you just got to do something else. Wait, Doc, wait, let me do this one. If you're not God, like Morgan Freeman.
I would say that most people would choose to do a denture, but I got to tell you, the longer I practice dentistry, the least amount of dentures I'm making. People are choosing to keep their teeth now.
So dentures is removable.
Yes.
That's the I'm thinking about when I grew up. That's the thing in the cup on the sink.
Right. Uh-huh. Right. Yeah.
I grew up with that.
Yeah, right. And that's what and I'm gonna tell you.
Partials, right? Partials, just some of it.
Yeah. No one likes that. And and I'm telling you, that is a thing that really is becoming something that we're seeing a rearview mirror, because most people don't want things that come out of their mouth.
So to get dentures, would you have to have all of your
Yeah. Yes.
So
I bet you're gonna floss tonight, right?
Listen, look, I am.
All right. Now you get it.
Like, look. The reason why I had my tooth pulled is because I had a cavity. I was like in maybe 3rd, 4th grade, something like that. So it's been a minute. So this is the new deal. So welcome, Dr. Jason Harris has now joined the Very Good Dental Practice. Where you located, bro?
325 University Avenue.
We're
at the corner of East Genesee and University.
All right. Check them out.
We have the purple awning. You can't miss it. The purple awning is the signature of the corner. We call that the connective corridor. I'm sitting right there smack on that connective corridor with a purple flag for you.
Very good. Welcome, Dr. Jason Harris, Dr. Zina Berry, part of the Very Good Dental Care. Everything you want to do, they could do it. But you said orthodontist, so you do braces too?
Yes.
Oh, okay.
Yes. And we're not orthodontists, but we have been trained for ortho care to include braces and Invisalign.
Invisalign. I know what it is, but tell me what it is.
So Invisalign are trays that you put in, sort of like the whitening trays you were talking about.
Yeah.
And those trays are made by a computer generated process, and they're precision made so that they move the tooth like a half of, let's say a pound per square inch per day. So in other words, it moves the tooth slowly over time to put it in the alignment so that we have proper function in order to bite and chew. And of course, the aesthetic smile that you want. All
right. Can I just see y'all smile? I want to see it. Well, go ahead. Go ahead, Doc. Listen, so good to see you both. Dr. Jason Harris, Dr. Zina Berry, Howard and Mahari up in here.
Yes.
Up in here.
Up in here.
Inspiration for the Nation. Check them out, 325 University Avenue. And we thank you, Dr. Berry. Very Good Dental Service, for the partnership with Inspiration for the Nation.
Thank you.
Thank you.
Bye-bye.